John. Thank you. Well, you know we have our standards high when we get a big clap for being the center least likely to be in a scandal. But it is wonderful to be here with all of you and after these great speakers, and I love that they focus not only on what some of the challenges are, but some of the solutions. And I think that's where we have to what we have to do to move forward here. And I did want to greet our out-of-town guests and bring you official Minnesota greetings from our state. It is a state where, in the words of our pseudo-poet laureate Garrison Keillor, right, the women are strong, the men are good-looking, you can kind of look around, right, and all the doctors and medical professionals are above average. We are a state with the nation's largest mall, if you haven't visited it yet, the Mall of America. We are the state with the world's largest ball of twine. I can tell you in the reception about the details. We are the state with the world's second largest hockey puck. And we are a state with the world's only Spam museum. Not far from here. We actually call it the Guggenheim. We are also the only state that has a doctor heading up a large medical clinic that's name is Dr. Noseworthy. That is my favorite thing. You have no idea how much fun I had bringing Dr. Noseworthy to the State of the Union and introducing him as with having the best name for a doctor, Dr. Noseworthy. And what I realized was all the senators, there's a dinner before the State of the Union with the senators only and their guests. And they had a few policy questions, but as you know, the Senate isn't exactly full of spring chickens, right? So they also had a lot of medical questions. I was listening when Elizabeth spoke, and she talked about how her dad was a doctor, or one of her parents was a doctor, and all I can say is I see a lot of doctors. And my favorite Mayo story was actually after I had a mess up with a hip replacement surgery the year of my first election to the United States Senate, 2006. Someone else had done it, it messed up. In July, I went to Mayo on 15 Advil a day and running for the United States Senate. They looked at it, they said, this never worked, it's going up and down. Dr. Truesdale came to my rescue, did the surgery. A week later, I have 5 debates in the next month. And as I'm coming out, I'm still on the operating table. Why I thought of this, I don't know. I wake up in the middle of the surgery because I'm on a sedative with a spinal, and I look up at him and I say, I think it was just the nurses at this point, is Dr. Truesdale a Republican? Good moment to think about this. And literally, 6 hours later, I'm laying there, he looks down at me, he's standing above. I don't have any idea why he's saying this because I don't remember it. He says, I'm an independent. That's my Mayo story. But he fixed my hip, and I went on to do Meet the Press in every single debate. I think my story with Mayo is not unique. From Dr. Edward Kendall and Dr. Philip Hench's discovery of the steroid cortisone to today's work by Dr. Ronald Peterson to identify biomarkers that predict who might develop Alzheimer's disease, Mayo's evolution reflects our evolution as a country. But today, when it comes to not only the transformation and the innovation and the work that you've just heard about from our last few speakers that needs to be done when it comes to payment reform and more transparency and making our healthcare delivery system work better, which is my favorite topic, but we also have another challenge, and that is continuing America's preeminent position when it comes to innovation and medical research. In one direction, we have sputtering research budgets, an aging biomedical workforce, the slow slippage from our historical spot atop the world's high-tech hierarchy. That's not the road that we want to take as a country. That's not the road we can actually afford to take when it comes to jobs and moving our economy forward. Instead, we need a new prescription for progress, embracing renewed national investment in biomedical research. We need to see this not just as a cost that must be shouldered, but as an investment, an export, an economic driver that can recharge our economy and renew our international leadership. I think we know it won't be easy, but it wasn't easy to turn a little frontier medical practice into one of the world's most prestigious medical institutions. It took work, and it took investment, and it took imagination. If you ever visit my office in Washington, we welcome you. We have breakfast every Thursday morning for anyone that wants to come. If you're lucky, we'll serve Spam puffs. But we have a drawing on the wall, and it's a woman who's holding the planet Earth in her hand, and it's being handed to her by an angel. And the words on the picture read, "In my dream, the angel shrugged and said, if we fail this time, it will be a failure of imagination. And then she placed the world gently in the palm of my hand." Well, the future of our nation's healthcare system and the future of our own health, and having just been in Africa, the future of the world's health, when you look at what's being the dreaded disease they're spreading with Ebola, it's truly in the palms of our hands. And I know there is no lack of imagination in our country. There is no lack of imagination in this room right now. There is a bit of lack of imagination in Washington to make those hard choices. And I'm going to get to that in a minute. And we're going to need your help, because it is our time to lead. While we can't say that innovation is a uniquely American concept, it's something that we've always done better than anyone else in the world. Every Minnesotan knows the story of Earl Bakken tinkering around in his garage and developing the first battery-operated pacemaker in 1957. But he wasn't alone. Medical gloves are an American invention. Electric hearing aids, an American invention. Adhesive bandages, an American invention. American scientist James Watson and his English colleague Francis Crick discovered the structure of DNA. Watson led the NIH component of the Human Genome Project, which helped complete the Human Genome Map in 2003. These days, we're mapping something even more complex, and that's the human brain, with work going on in here, work going on at the University of Minnesota, work going on throughout the country. And earlier this year, the FDA approved the first human clinical trial in the US for a wearable artificial kidney. What I want to do today is to talk about the challenges in keeping this work going, and then some of the solutions. I am not someone that likes to engage in a 24-hour TV shout fest and blame game that we see go often too much in Washington. In fact, when I heard Elizabeth and Mark speak, when Mark talked about some of these challenges with the ACO and transparency, I want to keep moving on delivery system reform. I actually did the quality index in the healthcare bill. When Elizabeth talked about the need to do something about pay for delay, which is an absolute outrage and is costing our country billions of dollars, I'm leading that bill with Senator Grassley. We have to pass it. When we look at reimportation from Canada, I'm leading that bill with Senator McCain. It's pretty simple for me. We can see Canada from our porch. And if they have cheaper drug prices, we want to see them in our country. Thank you for those people that remember that saying over there. Okay, let's go through the challenges. The challenges. The first challenge, of course, is funding for NIH. If we're going to make these artificial kidneys, if we're going to map the human brain, we need research, and the nerve center of that research is NIH. NIH supports researchers in every state, and 144 researchers supported by the NIH have been recipients of 85 Nobel Prizes. These great minds, more than 10,000 at the NIH campus and 300,000 spread out among 2,500 universities and colleges and hospitals, advance science. NIH-funded research is often high risk, and commercialization is far from guaranteed, but the NIH has long been the foundation upon which our nation's biomedical innovation rests. And we all know that funding has not been going up. It got a little more funding during the stimulus, but there have been major, major challenges with NIH funding. Challenge 2, government dysfunction. This is a true challenge. I literally thought we had reached our lowest moment in the Senate during the fiscal cliff vote about a year and a half ago, when we were literally going to go over the fiscal cliff. And I remember we voted until about 3 in the morning, and there I was on New Year's Eve at midnight, that magical moment, right? New Year's Eve. I look to my left and I see Harry Reid. I look to my right, I see Mitch McConnell, every girl's dream, okay? New Year's Eve. But instead, it wasn't the lowest moment. It got worse, and it got worse with the government shutdown. As you may remember, 70%, this is just NIH, I could go through the whole economy, but 70% of NIH workers were furloughed. About 200 patients who otherwise would be admitted to the NIH Clinical Center were turned away, including about 30 kids, most of them cancer patients. That was an outrage. I am the only senator that during that time, a lot of senators gave their salaries away. I gave my salary to the NIH because I wanted to make one point, and that is that we so often underestimate when we look at government funding what this kind of investment means for our country and what it means for the well-being of the people that we serve. Now, what happened after that shutdown? There's a little good story. The public got so pissed off that we actually got a budget out of it. We got rid of half of the sequestration, right, which helped with NIH funding. But we still have a lot more to do to be able to get to a point where we're bringing the debt down in a reasonable way by a mix, not just spending cuts, but a mix of revenue and spending cuts, and that we don't do it on the backs of NIH research and things that we know are going to further the economy in America. That's the second challenge, government dysfunction. The third one, global competition. While the U.S. still remains the largest spender on research and development, accounting for nearly 1/3 of global R&D in 2011, waning investment is threatening the edge. China, Singapore, South Korea, and the EU are investing heavily. Over the past 10 years, research and development expenditures have grown by nearly 50% in South Korea and 90% in China. Here in the United States, as the researchers in this room know, they've been flat. Fourth challenge, recruiting the best and the brightest. At a time when the need for additional research is growing, our population is aging, and a rising middle class around the world is increasing demand for treatments. This should be a good thing for the U.S. because we make a lot of things that they need for the treatment, we make a lot of drugs that they need for the treatment, and we know how to do health care. But in fact, we are getting less and less researchers into the pipe to develop that next generation and to work with these other countries. Success for basic research grants is at an all-time low. Fewer than 1 in 5 grant applications are successful because there's simply not enough funding to go around. The sting is felt most severely by first-time applicants. In 1980, the average age of an investigator at the NIH was 39. In 2008, it's 51. There's a difficulty in obtaining funding, and that funding means that we cut off promising young scientists. We make them give up their dreams. Even more alarmingly, some of our best and our brightest are seeking opportunities overseas. James Rothman, chairman of the cell biology department at Yale, won a share of the 2013 Nobel Prize in Medicine for his work mapping the human cells transport system. The research was developed over 15 years, financed by the federal government. Or it was, until the professor lost his NIH funding. Now he advises his students to pursue research careers in other countries where the funding is more predictable. And his students aren't alone. A 2013 survey of scientists by the American Society for Biochemistry and Molecular Biology found that 18% of respondents, nearly 1 in 5, were thinking about moving to another country to continue their careers. How many Nobel Prize winners are we going to lose before we realize we have to change the way we do business? How many have we already lost? We shouldn't be losing our best and our brightest overseas. We should be keeping our best and our brightest here and bringing the best and the brightest to help around the globe, but having them come out of the United States of America. Now, the solutions. That was a lot of really heavy challenges, but there are solutions. The first one, of course, is funding for medical research. And by the way, there has been in the past bipartisan support for funding for medical research. You saw it in the work that Arlen Specter, when he was a Republican, did. You see it in the work for bipartisan support for disease cures all across the board. So I do not give up hope on bipartisan support for funding for disease. We know research is expensive and we're in a tough fiscal climate, but investing in research just doesn't save life. It also preserves our place as an international leader and means jobs. The life science industry contributes about $69 billion annually to the U.S. economy and supports more than 7 million jobs. That's why I've worked with Senator Harkin, who, as you know, chairs the Health Committee, to introduce legislation to boost NIH funding over the next 5 years. We have all heard how devastating sequestration was, and our bill, which is called the Accelerating Biomedical Research Act, would move the draconian budget caps and allow NIH to have the same purchasing power it would have had if the funding had kept pace with inflation since 2003. There's also another bill that I'm co-sponsoring called the American Cures Act. It establishes a biomedical research trust fund administered by Treasury to support work at the NIH, at Center for Disease Control, Department of Defense, Veterans Medical, and this is more sustained funding that we have now. And maybe as we see the horrid, tragic situation in Africa, maybe this will make people more interested in making sure that we're funding the kind of research that we need to not only make our country a better place, but the rest of the world. Solution number 2, public-private partnerships. The NIH and other federal research agencies can't do it alone. The NIH routinely partners with outside organizations. We know that. A key player is the Foundation for the National Institutes of Health. Our research dollars go furthest when public and private organizations collaborate. NIH funding doesn't displace private research, and I want to make that clear. It complements it. For example, in the pharmaceutical industry, a $1 public investment in basic research is estimated to lead to an additional $8.38 of private research and development funding after 8 years. Or take the Biomarkers Consortium, a research partnership managed by the Foundation for NIH that includes a broad coalition of agencies, for-profit companies, nonprofits, that is working to establish biomarkers or signals our bodies send that can tell us if we're at risk for developing a disease. There's other great partnerships. IBM Research recently completed a year-long collaboration with Cleveland Clinic to develop cognitive computing tools to help doctors and medical students make more accurate decisions faster. Solution number 3, hubs of medical research. Well, you're seeing one right here where the state of Minnesota has made really some groundbreaking decision to embrace the opportunity of a medical hub with the Destination Medical Center that we're developing right here in Rochester. This was significant funding. It was an acknowledgement that we are competing with the rest of the world, that we want to bring in international patients into the U.S., and we want to make this as attractive as possible. It's not a pipe dream, and you see what's happened in North Carolina with their hub, with the Research Triangle Park, and how that has worked not just for Duke and the University of North Carolina at Chapel Hill and North Carolina State, but it has also helped our country and our companies, and that's just one example of what we're doing. Solution number 4, revolutionize patient care, and that's really what you've been hearing this morning from our 2 great speakers. I mentioned some of the ideas that I have early on. I always think of the Affordable Care Act as a beginning, not an end. I think when it comes to delivery system reform, we know that it makes some first good steps. I know Atul Gawande wrote a second article after his famous article about the need for the reform. He wrote a second article about how all of these different things in the Affordable Care Act, likening it to the Farm Bill in agriculture 100 years ago, some of these practices started seeping in because people saw those incentives and they made changes. We see that transform, going on right now, but I think we know that there has to be more incentives in place when it comes to transparency, when it comes to payment reform, so this works the way it's supposed to work. I'm not going to go into detail on this, but I'm a big fan of the bundled payment with the idea that we have here in Rochester where doctors work as a team. I always tell the people in our state that if we're not careful, and so far it's been happening, our money, taxpayer money, is going down and being sucked down in one big transfusion tube to Florida. Sorry, Florida people, and some of the states that are not as efficient in how they administer their healthcare systems, and we have to put incentives in place to make them more efficient. Another initiative from the health reform law, accountable care organizations build off the work begun by Mark McClellan when he was the head of Medicare. In these ACOs, doctors and nurses team up to provide care to patients. Technology, obviously another powerful tool. I talked to a few of you out in the hall that are working in that area. So that's a piece of it. Solution number 5, STEM education. I love what's going on here in Rochester. I've been at the elementary schools where doctors are coming in and working on zebrafish with elementary school students. So you've got like little 5th graders talking about how the zebrafish reproduce, and they say there's so many zebrafish you won't believe it, and they're learning about science in a way that's welcoming. We need to be doing that across the country to get more kids to go into science, technology, engineering, and math. We need to change the mindset of their parents so their parents understand that there's good jobs in these areas. This is the future, because in a state like Minnesota, where we're down to 4.5% unemployment and our Twin Cities metro area has the lowest unemployment of any area in the country, we actually need people with the skills to fill the jobs. That's what we have to do. Solution number 6, this is my last one, immigration reform. As John mentioned, Washingtonian Magazine voted me and Orrin Hatch the 2 senators least likely to get into a scandal in Washington, and I assume that includes with each other. But in fact, we have been working on a lot of bills together, and one of the bills that we worked on was called Immigration Innovation I-Squared, and it's a major part of the immigration bill. It fixed some of the green card and the visa issues with our current immigration system, and really got at that point when it comes to research, when it comes to innovation, that America has always led because we've opened our doors. And right now we have a situation where the Wild hockey team, as much as we love them, our professional team can get unlimited visas from Canada for their players or from anywhere else in the world, but Mayo can hardly get in a spouse and give them a job when they bring in a doctor. That is wrong. Look at our history. 200 of our Fortune 500 companies were formed by immigrants or kids of immigrants. 90 of our Fortune 500 companies were formed by immigrants. 30% of our US Nobel laureates were born in other countries. This is how we've made our country great, because we've opened our doors to people that bring in new ideas that create jobs. Not to mention that the Senate bill that we passed with 67 votes with a bunch of Republicans voting for it actually brings down the debt by $160 billion in 10 years and $700 billion by 20 years. And that is why Grover Norquist has made it his #1 priority, because it brings the debt down. So one of my goals in life is to get the House of Representatives to pass that bill. I see it not only, we can talk about all these immigration issues, but when it comes to this pure fact of jobs and in the fields of technology and science and engineering, it really has been opening our doors that has made our country what it is today, and we cannot cut off that supply. So that is my solution number 6, is getting that bill done so we can bring in some new ideas, and that the next Mayo Clinic or Microsoft or Scripps Research Institute will not necessarily be in Beijing or Munich or Mumbai. It's great for them. We would like more to go on in our country, and we want to bring people in, and we don't want to keep educating people. We're literally training our competition. It's great they come in to University of Minnesota and other places, but then we literally close the door and say go back home instead of giving them the opportunity to work in our country. In the end, we need to remember that the point of research and innovation, what it really is, it's about saving lives, it's about making lives better, and it's about giving hope when hope seems lost. Continued hope and progress are not a given. Far from it, because if we're not investing in the future, if we're not continually striving to do better, then we're falling behind. There's a speech that John F. Kennedy gave at Rice University in 1962. That's where he talked about putting a man on the moon, but I'm not using that quote. He said, "The U.S. was not built by those who waited and rested and wished to look behind them. It was conquered by those who moved forward." Those words still ring true today. And at a time when our economy is clearly stabilized and actually pretty good in Minnesota, it is sluggish nationally. At a time when the developing world is progressing at lightning speed with so many challenges, and at a time when our healthcare needs are outpacing our innovations, one thing is clear: we need to be paying those words of Kennedy more than lip service. We are truly at a turning point, at a place where we cannot rely on exhausted ideas or outdated paradigms, at a time when we cannot accept falling behind on a biotech stage, at a crossroads where we can't settle for the status quo, where we must choose progress over stagnation. That's our challenge, but I believe in my heart, having lived in this great state my entire life, that we can meet that challenge head on with our eyes open, with a laser focus on the things that have made America great in the first place. That's an appreciation for science and technology, an unfailing commitment to innovation, and a stubborn faith that when it comes to the human capacity for invention and progress, not even the sky can set the limits. Thank you very much.
Thank you, Senator.
Okay.
That was great. Tell me something about your trip to Africa that you'd like to share with the group here.
Well, I just came back. We had our first all-women senator trip, really in the history of the Senate. We have 20 of us there, as you know, so much so that about a year ago, I sent out a tweet that went viral that said, for the first time in the history of America, we actually had a traffic jam in the Senate women's bathroom. But we are a mighty force and have been leaders on many things, and the 5 of us decided that we needed to go to a region which is also emerging as a place where, one, major trade and export possibilities for the U.S., 2, with major challenges where our country can help, but our country can also build a relationship that in the end will be good for our country. So the focus of our trip was going into a lot of the rural areas where things literally agriculture, I'm on the agriculture committee, is done in a way that is literally a century old. But we also spent time with the Gates Foundation on those ag issues, but also health initiatives. And my most memorable moment from that trip, we met with the Prime Minister of Ethiopia for an hour, and then we headed out to the rural areas and sat for hours in one of their clinics where they have transformed villages. They have transformed villages that before that time literally would have baby after baby. Moms would have baby after baby, and these babies would die and they'd get malaria. And they have taught it in a very interesting way. They don't use the words family planning or birth control. They say, when you ask them, how many kids do you have? The moms say through an interpreter, I have 3 children. I have spaced them out 4 years each. That's how they talk about it. They also have used these health volunteers with the government of Ethiopia, investing in thousands, tens of thousands of health leaders, and then they use volunteers in each village. And we went to one hut, pitch dark. This woman's a widow with 2 children, very proud of her tiny little farm. And she showed us the only thing on this hut. It had a corrugated roof. She walks an hour and a half to get water every single day. And the only thing on the wall of her hut was the Gates Foundation organizational chart for her village. And she was so proud, and she pointed to her on the wall and said, I am a health leader, and I take care of these 10 houses, and I make sure if they have a baby, she had pictures of a baby, if they had a baby that they'd stick on there. If they were sick, she had another picture. If they didn't have any kind of a toilet, I mean outdoor, we're talking here outdoor, she put a thing on for that. And she would monitor what was going on and make sure that they were getting the health care that they needed. And when we asked her if she had any challenges, after I laid out all these, she paused and said, I have no challenges. I am doing so much better. So that was pretty heartwarming, and I think when you see the possibilities of what we can do when it comes to healthcare, we know the challenges, what we're seeing right now with Ebola, but the possibilities are there for that country.
Well, that story really underscores just how in healthcare, whether you're in the developing world or in the industrialized world, that it is a community-driven reform movement, that really there has to be people in the community on the same page with a shared vision to try to make change and to improve health within the community. And speaking of shared vision.
And by the way, your next speaker is going to come out from Aetna very soon. Nice segue.
Yep.
But I think if you asked him that question, we talked about how there is such an opportunity here to set things up differently in these countries and to just start from scratch because they have no infrastructure at all, and not to make some of the same mistakes that we've made. But I don't want to take away from the fact that there really is some improvements economically going on in these countries, and there's great possibility. So what were you going to ask?
Yeah, just noting that a shared vision is essential for healthcare reform. A shared vision is not something we associate right now with Congress.
Really?
Yeah. Do you think the next 12 months will be about repealing Obamacare, or will it be about the reforms that you've described?
No, I think that has proven, as much as there have been some enormous problems, website on down. Did you know the people that fixed the website were from Minnesota? True story. Subsidiary of United Healthcare.
Oh, of course.
Oh, yeah,
Of
I just
course
thought
they
I'd get
were.
that in, you know.
Yeah.
Yeah, there's someone out there. Thank you. But there were enormous problems with that, and also I personally don't think that the bill went far enough with some of the healthcare delivery system reform that the people have talked about here, and there's so much work to be done. But I do think for the people that just say repeal the whole thing, it's like moving the big ocean liners, you know. I don't think that's gone over that well, truthfully. I think people know we have to make changes to it. There's some things that still need to be corrected clearly, and then we need to go into thinking about how to do this delivery system reform, or we're never going to get where we want to go. So even though I know in some states that's been the subject of huge ad campaigns, I truly don't think that that's going to happen, because it would be just very, very difficult to go backward. And also people have appreciated some of the things, a pre-existing condition, keeping your kids on the insurance till you're 26, some of the things it did with Medicare Part D. So I think the bigger focus after we get out of this election, I'm not up, so don't worry. But I just want to get to a point where we can actually work on common sense reforms, bipartisan basis, like I always do things, and get some of this behind us so we can move on to some of these bigger challenges, including long-term care.
Final and most important question. Do you think House of Cards will be tempted by the Hatch-Klobuchar scandal plotline?
Well, and you know, he sings too. You know, he's very good.
Oh,
do
yeah.
tell. No, I mean, we could be very good together on that. No, I have a feeling that's the problem with, you know, people that kind of try to work on things in a positive manner. You don't always get to be the subject of these TV show scandals, but. Maybe. In all truth, my hope would be someday, and some of it can happen. We saw some of it with immigration reform, some of it with the Gang of Six and Gang of Eight on trying to fix a debt. When senators insist on going on together on these shows where they talk about, they have some differences, but something where they're working together on common ground, I think that that means the world to people, that they really want to see that kind of change. And every show right now in Washington, from Scandal to House of Cards, and no, people aren't getting so bad that they're murdering other people. I just want you to know that. I don't want to give the plot line away. But I think that we really need to come around and realize that success in Washington means success for the country. And success for the country isn't standing by yourself giving a speech to an empty chamber. Success is whether or not you're willing to stand next to someone that you don't always agree with for the betterment of this country. And that's what we need to do.
Thank you, Senator.
Okay, thank you. Appreciate it.